Hi, my name is Amy Whitmore. I am in NR224 at Chamberlain University in New Orleans. My D number is 411-05325, and this is my wound care video. Hello, Mr. Wayne. My name is Amy. How are you today? Great. I am here to do some wound care for you and change out your bandage, but before we get started, I need to verify your name and date of birth, please. Can you say your full name, and I'm going to compare it to my chart? Bruce Wayne, thank you very much. And your date of birth, please. 1963. Excellent. Thank you very much. So Dr. Ivy has ordered some wound care. So basically what we're going to be doing is we're going to remove your old bandage. We're going to get everything cleaned up, and then we're going to put a new bandage on, and at the same time we're going to check and see that everything is healing appropriately and that there isn't any infection in your wound. So are you okay with me doing all this? It's going to take about 10 to 15 minutes. You are? Excellent. So do you have any allergies? You're allergic to sulfa drugs. Okay, I do have that noted on your chart. I also have noted on your chart that you were given some pain medicine about 30 minutes ago. At the time, your nurse said that you had a pain that was 6 out of 10. So after 30 minutes, on a scale of 1 to 10, what do you think your pain would be rated at now? A 0 out of 10. Excellent. I am glad to hear that. That'll make everything so much better. Okay, so what we're going to do is we're going to shut the curtain for privacy, and I am going to do a little bit of hand hygiene here right before I get my gloves on, and we are going to get started cleaning your wound. So I will apologize for any noise you may hear in the background. My nursing assistants are taking care of some of the therapy dogs at the moment. So it's a bit rambunctious here. I know, it's craziness, isn't it? Do you like dogs, Mr. Wayne? Okay. All right, so the first thing we're going to do is we're going to remove your old bandage here. All right. Just gently remove it. Perfect. And we are going to get that discarded. Oh, yes, this looks like it's healing nicely. So let's do a quick assessment of it. So let's look. So first off, the color is a little bit red around the edges, and I do see some red in the wound, which is normal for Mr. Wayne's color and consistency and ethnicity. I do not smell any odor, which is a good thing. And I do see some watery, clear fluid coming out, some serous fluid. It's just a small amount, and that is normal for this particular type of wound. I am so sorry. So the next thing I need to do is get everything measured. So Mr. Wayne, I'm going to measure your wound at this time. And let's see, so if we're measuring from end to end, we're measuring lengthwise first, and I see that your wound is at about 7 centimeters. And, excuse me, Miss Nursing Assistant. All right, we're also going to measure around widthwise, and I see that your wound is measuring approximately 2 centimeters that way. Now, the next thing I'm going to do, Mr. Wayne, is I'm going to take this cotton swab here, and I am going to gently probe into your wound. Please tell me if I hurt you at all. Yeah, let's see. And what I'm doing is looking for the deepest part of your wound. So, looks like we're going to go about right there. So when we measure that out, I am getting approximately 1.5 centimeters depth of tunneling. So I am now going to discard my cotton swab, and I am also going to discard everything else that I don't need at this point. So this is all going to go. We're going to dispose of that in the trash can. And now, Mr. Wayne, what I'm going to do is I'm going to put on some PPE. I'm going to redo my hand hygiene real quick, and I'm going to put on my gown and my mask, and I also have my eyewear already on, but if I didn't, I would put on a, if this was not appropriate for my facility, I would put on a face shield as well. So what we're going to do is we're going to get sterile at this point. Everything that we do from here on out is considered a sterile procedure. If you excuse me just a quick second, my nursing assistant needs to deliver some apple juice to the pediatric unit, so she is going to do that for me real fast. Here you go. Bye, nursing assistant. Okay, so now we're going to get sterile. So hand hygiene, I have my full PPE donned, and Mr. Wayne, this is where we're going to get everything cleaned up. You're going to be glad that you have that that medicine in place. So I'm going to take everything off. I'm creating a sterile field here. I have put down a sterile sheet at this point. From here on out, I'm only going to stay within 2 inches of my sterile field. I do not want to deviate from that. So I am opening my wound care tray. And the first thing I'm going to pull out are my gloves. And I'm going to don my gloves in a sterile fashion. I'm going to start with the first one. I'm going to gently pinch on the folded part of the glove. And I'm going to wiggle my fingers in here. Alright, and then with my thumb up, there we go. I'm going to scoop my gloves in from that side. I can now kind of touch my gloves and get them fixed up. I'm going to discard my paper appropriately to the proper receptacle. Now, I need to get all of my sterile supplies ready. I'm still maintaining a sterile field. So I'm going to pour some saline water, this is sterile saline, into my tray here. I have some gloves. Let's get rid of this gauze. We don't need it at the moment. Get a few other things together. And we have a syringe here. It's approximately, this represents approximately somewhere between 30 to 60 cc syringe that I'm going to use to irrigate Mr. Wayne's wound. So what I'm going to do is I'm going to draw up some saline, and I'm going to take this abdominal pad and gently put it here. It's going to help kind of catch some of that irrigation. So what I'm going to do is I'm going to irrigate the wound from top to bottom, going side to side until the solution comes out clear. This may take me a couple of passes. So Mr. Wayne, so we're going to go ahead and get started, okay? So I'm starting at the top and I'm gently going side to side, going down, and then I'm going to pat the irrigation out with a gauze. I'm going to pat it dry, and then I'm going to throw the gauze out into a bio receptacle, and I am going to repeat one more time just to make sure everything comes out clear. So again, I'm starting from the top of the wound and I'm going side to side gently, and I am catching the overflow with my sterile gauze, and I'm going to gently pat dry. I do not reuse, and then I'm going to throw away my gauze into the appropriate receptacle. So now what I need to do is get a measured out gauze. I have approximately measured this one based off of Mr. Wayne's wound, and I'm going to wet the gauze until it's moist, using my cotton applicator. Let's make sure this is coming up correctly. There we go. We are going to gently pack the gauze into Mr. Wayne's wound. Being gentle, taking our time, and making sure that it covers everything and that it is flush with the edge of the wound. This is to prevent any infection from coming in. So I'm going to discard my applicator, and I am now going to take a non-absorbent pad. I'm going to put over it. I'm going to take my tape. I'm going to tape around. I'm sorry, Mr. Wayne, you're a bit hairy. I'm going to try to be as gentle as I can. My nursing assistant is very cheerful tonight. She loves to make sure that you're feeling good. I hope she's cheering you up. Did you know her name is Harley Quinn? It actually is, yeah. True story. Alright, we are going to gently put this around. Again, throughout all this, while we're getting everything done, we're still trying our hardest to maintain a sterile field. And one more time, so what we have done is created sort of a picture frame bandage, and now I am going to take my sticker that I have already initial time and date on it. We're going to apply this to your dressing, like so. Discard that. Mr. Wayne, are you in any pain, discomfort right now? What is your pain level at this time, since, you know, I did take the time to probe around you there? You're about a 2 out of 10. Yeah, I can certainly understand that. Okay, so what I need to do at this point, Mr. Wayne, is I am going to lower your bed back down. I had you up to about my hip. I'm going to bring you back down all the way to the bottom. I'm going to lift your side rails up. Let's make sure you call lights over here where you can get to it. Let's double check to make sure the bed is locked. Good deal. Let's see, we've got your call light, we've got everything you need, Mr. Wayne. Is there anything else that I can do for you today? You have been super helpful. Thank you so much. You are a wonderful patient. I will send my nursing assistant in to get all this cleaned up here in just a minute. While she does that, I am going to go ahead and document a few things. I am going to document what I saw earlier, that he had a red wound. That there was no odor present. He did have a little bit of a thin serous fluid. That is normal. That is a normal amount for his particular type of wound. His measurements, the length was 7 centimeters, the width was 2 centimeters. He was having some tunneling at about 1.5 centimeters. There was just a tiny bit of eschar noted around the edges. If it was a little bit more, I may not be qualified to get that cleaned up, and I may have to consult wound care at that point. We put a wet to dry dressing on, and we signed and dated it with the time that we did it. I irrigated the wound, I cleaned it all out, so we have all of this documented here in his chart. He has said that after the procedure, his pain is now at a 2 out of 10. I will have to go back and consult, but more than likely it is a bit too soon for him to have more pain medicine on board at this time. So, Mr. Wayne, if you don't have any other questions or anything else for me, I certainly appreciate you letting me take care of you today. And again, you have your call light if you need anything. Thank you.